Step 34, post-procedure recovery after the egg collection. I will explain you what activities you can do after the egg collection procedure, what level of observation you need, what kind of pain you should expect, and what pain relief you can take, and also what risks you should watch out first few days after the egg collection. After the egg collection, you will be monitored by clinic team. They will be calling you, they will be checking with you to make sure you're having normal recovery. If you have any concerns, directly you should contact your clinic. If you can't reach your clinic, you should speak to your own doctor. If you can't reach your doctor, if you're not feeling well, then you should go to the local emergency department. That's general advice, but you need to strictly follow your clinic's own advice about the recovery process after the egg collection. The day of egg collection, you should not have any work or social commitments. You need to relax at home, because you will have had general anesthetic. Then you need to really relax and you should be at home, and your partner or family member or friend should be with you next 24 hours physically in the same premises, because you had anesthetic. You need to be observed with someone who is close by. And then also, because if you have any complication, they should be able to help you, which is very rare. Having complication after the egg collection is very, very rare, but still you need to be mindful, because you had a surgical procedure. There's small possibility of having problems on the day of egg collection. In terms of pain, you may have some moderate pain after the egg collection, but you can relieve the pain using codeine, paracetamol, tapentadol, tramadol type medications, or endone. And the main risk on the day of egg collection you should watch out is bleeding. You may have a little bit of vaginal bleeding, that's normal, but if you have having heavy bleeding vaginally, that's not normal. You need to immediately report to the clinic or your doctor. Then there's very, very small risk of bleeding inside your tummy. That's very, very small. But if you're having any symptoms of that bleeding, like if you're feeling dizzy, if you're not feeling well, if you're vomiting on the day of egg collection, then you need to report to the clinic, and you need to report to your doctor, or you need to go to emergency department. First day after the egg collection, that's next day after the egg collection, you can pretty much go back to your daily routine. If you're feeling completely fine, you can go to work. And in terms of observation, your partner or your friend or family member should be close by. So that you can easily reach them with the telephone call, and they can attend to help you with any issues you're having. In terms of pain, you may have a mild pain. You still may have some pain after the egg collection, because after retrieval of the eggs from the follicles in the ovaries, follicles will collapse in themselves, and you may have a little bit of bleeding inside the follicle. That's normal. That's how ovaries heal after the egg collection or ovulation. And that may irritate your tummy a little bit, and you may have some pain. That's expected. You can relieve the pain with paracetamol or codeine or endone. And the main risk here you should watch out is the pain. Just if you're having very unexplained strong pain on the day one, that's not normal. You need to contact the clinic or your doctor, or you may need to attend emergency department. On day two, after the collection, pretty much you can go back to normal daily activities. Of course, you can't do strenuous physical exercise, but you can just do gentle exercise. You can go to work, and in terms of observation, someone should be available if you need them. Then in terms of pain, you should not have much pain. You may have a minimal pain, and you may or may not need any pain relief. Main risk here to watch out is ovarian hyperstimulation syndrome. Typically after day 2, day 3 after the egg collection, if you are developing OHSS, you will start having symptoms. That's bloatedness on your tummy, feeling a little bit pain, breathlessness. These are the symptoms of OHSS. If you have those symptoms, you need to contact your clinic or your doctor. And generally the egg collection is very simple, straightforward procedure. It's a very safe procedure. Recovery is very simple and straightforward. And occasionally you may have these complications like ovarian hyperstimulation syndrome. You may have a pain, and if you have any of those symptoms, you need to contact your clinic and discuss with them. And of course, you strictly should follow your clinic's own instruction in terms of recovering after the egg collection.